Metabolic syndrome, ticking time bomb. I will give you a summary first. Metabolic syndrome is a cluster of conditions that increase your risk of heart disease, stroke, type 2 diabetes, and other serious health problems. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol, or triglyceride levels. Causes of metabolic syndrome. The exact causes of metabolic syndrome are not fully understood, but they are believed to be a combination of genetic and lifestyle factors. Some of the risk factors for metabolic syndrome include overweight or obesity, excess body fat, especially around the waist, inactivity. People who are inactive, sedentary, deskbound or sitting down are more likely to develop metabolic syndrome. Family history. Having a family history of metabolic syndrome, diabetes, or heart disease increases your risk of developing the condition. Age. Metabolic syndrome is more common in older adults. Always consult your doctor or health care professional before making any changes to your medication or major change in lifestyle. Metabolic syndrome, a clustering of health disorders, is a ticking time bomb that silently increases the risk of serious health complications, including heart disease, stroke, and type 2 diabetes. This intricate web of conditions, also known as Syndrome X or insulin resistance syndrome, is characterized by a combination of 5 key factors. Central obesity, excess abdominal fat, often referred to as an apple-shaped body, is a hallmark of metabolic syndrome. This type of fat distribution is more closely linked to health risks than fat stored in other areas of the body. 2. High blood pressure, hypertension, or high blood pressure, is another defining feature of metabolic syndrome. It occurs when blood pressure consistently exceeds normal levels, putting excessive strain on the heart and blood vessels. 3. Elevated blood sugar levels, a precursor to type 2 diabetes, are a common feature of metabolic syndrome. This condition arises when the body's insulin production or utilization is impaired, leading to an excess of glucose in the bloodstream. Abnormal cholesterol and triglyceride levels, low levels of HDL cholesterol, the good cholesterol, and high levels of triglycerides, a type of fat found in the blood, are also characteristic of metabolic syndrome. This imbalance contributes to atherosclerosis, the buildup of plaque in the arteries, which can lead to heart attacks and strokes. Insulin resistance. Insulin resistance is the underlying culprit behind metabolic syndrome. It occurs when cells become less responsive to insulin, a hormone produced by the pancreas that regulates blood sugar levels. This resistance leads to elevated insulin production and a cascade of metabolic disruptions. Medications for metabolic syndrome management. While lifestyle modifications are the cornerstone of metabolic syndrome treatment, medications may be necessary in some cases to manage specific risk factors. Metformin is a cheap medication or drug used to treat diabetes, may reduces metabolic syndrome by reducing hepatic glucose output, decreases intestinal absorption of glucose, and increases glucose uptake in the peripheral tissues, muscle and adipocytes. It is a major drug for use in patients who are obese and have type 2 diabetes. Hypertension. Medications for high blood pressure include ACE inhibitors, angiotensin II receptor blockers, ARBs, calcium channel blockers, and diuretics. Hyperglycemia. Medications for elevated blood sugar levels include metformin, sulfonylureas, thiazolidinediones, TZDs, and incretin mimetics. Dyslipidemia. Medications for abnormal cholesterol and triglyceride levels include statins, fibrates, and bile acid sequestrants. Consequences of uncontrolled metabolic syndrome. While we are in the middle of the video, do not forget to hit the like button while watching this video. Failing to address metabolic syndrome can lead to a cascade of serious health complications, including heart disease. Metabolic syndrome significantly increases the risk of coronary artery disease, heart attacks, and heart failure. Stroke. The combination of high blood pressure, high blood sugar, and abnormal cholesterol levels raises the risk of stroke, a condition that disrupts blood flow to the brain. Type 2 diabetes. Insulin resistance, a core component of metabolic syndrome, often progresses to type 2 diabetes, a chronic condition characterized by high blood sugar levels. Other health issues. Metabolic syndrome also increases the risk of non-alcoholic fatty liver disease, sleep apnea, and certain types of cancer. Prevention and treatment, a lifestyle approach. The key to preventing and managing metabolic syndrome lies in adopting a healthy lifestyle. This includes diet. A balanced diet rich in fruits, vegetables, whole grains, and lean protein can help manage weight, blood sugar levels, and cholesterol levels. Physical activity. Regular exercise, at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity per week, can improve insulin sensitivity, reduce abdominal fat, and lower blood pressure. Weight management. Maintaining a healthy weight is crucial for reducing the risk of metabolic syndrome, and its associated complications. Smoking cessation. Quitting smoking significantly lowers the risk of heart disease, stroke, and other health problems related to metabolic syndrome. Stress management. Chronic stress can exacerbate insulin resistance, and other metabolic abnormalities. Practicing stress reduction techniques, such as yoga or meditation, can help manage stress levels. See the description and comments for reference. We would appreciate your comments in any language. Metabolic syndrome, a cluster of health disorders, is a serious concern that can lead to devastating health consequences if left unaddressed. By adopting a healthy lifestyle and addressing specific risk factors with appropriate medical interventions, individuals can significantly reduce their risk of metabolic syndrome and its associated complications, improving their overall health and well-being. Thanks very much for watching this video. Do not forget to click the like button. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video. Up above you see a video relevant to this. Watch that and it will help your health.